Hello, this is Lucinda Nord with Indiana Association of United Ways, and I'm joined by
Brian Metzler with Indiana 211 Partnership in the
Great,
Healthcare Project.
and we are here to welcome you to the first in our three-part series for specialists only in our healthcare mini webinar series. And this session we will talk about how to ask, how to pre-screen, and how to refer. In this session, we're going to talk a little bit about the big picture, about healthcare insurance in Indiana, what those options are, and then what we are actually doing in our healthcare project in terms of asking the question, pre-screening, and referral. We will work through the screening and refer, and then this session will actually be followed up by two more in-depth sessions related to the frequently asked questions we're getting in pre-screening and the frequently asked questions we're receiving in referring and those callers who've already tried something. So just as a reminder, the Affordable Care Act was enacted by Congress in 2010 and represents one of the largest changes to human services in recent memory. And as 211 service providers, we all know that one of the first things that we do is to update information whenever there's a big change in the human service sector and to help educate our consumers or our callers about those changes. We, as Indiana 211 Partnership, actually engage a wide range of callers and a wide range of web searchers as well as providers and stakeholders in this process. And 211 was engaged in this healthcare project because 211 is a trusted resource for all of those different stakeholders. The pie graph there just illustrates our caller needs as identified in 2012, and we're anticipating getting those 2013 numbers up very soon. As a reminder, the healthcare project has four primary objectives. The first is to maintain information about the healthcare options, including the navigators that are available throughout the state. Secondly, and what's most important for the 211 specialists around the state, is this notion of providing pre-screening and referrals to a subset of callers, much like what we do in SNAP, but with some slight variations. So with this project, we intend to ask 100,000 callers if everyone in their household has health insurance, and we plan to do that throughout the year in 2014. Of those, we will pre-screen, refer, and get a follow-up where it's appropriate for about 4,000 households who identify themselves as being uninsured and who are willing to follow through on the pre-screen because consent is really important. And then we will follow up with outcome surveys to at least 400 of those referred clients or households, or to those callers who report that their application is pending, for example, if their application is pending in the marketplace. So that's the bulk of the work for the 211 system. But then with our new healthcare staff, they are actually maintaining a master calendar of those healthcare outreach and enrollment events. And then as a system, we are going to be providing regular reports to healthcare stakeholders about the resources that are available, the needs that we're seeing through callers, the gaps that we're seeing between the resources and the needs, and whatever trends we're seeing over time. So this map at the right illustrates just one of the first sample reports that was created for those healthcare stakeholders using the wonderful new data that's being produced by Brian Metzler, our healthcare project coordinator, and Peggy Matson, our healthcare resource specialist. And what this map shows, I know it's hard to read, is a level of population by each county, the applicant organizations that are currently listed with the Department of Insurance, and the number of navigators in a given county as certified by the Indiana Department of Insurance. The difference in the coloring of the map, the beige counties are currently, or at the time that this map was created, which was early January and before we did quite honestly a lot of work on our resource side, illustrated those navigator organizations where they were accepting referrals from 211. Excuse me, not accepting. The green colored counties are the counties that where we have referral capability for 211 to navigators. So what this identified was that we had a real gap, and you all told us this as 211 centers. You were telling us that there were navigators in your communities, but that they weren't willing to accept 211 referrals because they were already concerned about their own capacity and their own client base. So this is something that's important for healthcare stakeholders to understand and to know, and for us to monitor over time. So this just gives you one example of a data point that we're going to be watching over time with our healthcare stakeholders. And it really illustrates the importance of data for this work, that healthcare stakeholders are really looking to Indiana 211 Partnership for both the qualitative data and the quantitative data to really ask a big picture question, and that is, how is this new healthcare law, the Affordable Care Act, working in Indiana? So things that you might be thinking about as a specialist, if you could sort of jump up to the 10,000-foot level and think about if you were a planner or if you were a funder, how would you be interested in the information about how the healthcare system is working in Indiana? So how are those healthcare resources working? Where are they available? Are there enough resources in a given county? How are they working together? And you who work in the communities, you know which agencies work together really well, but how do we document that? What are our callers' experiences? And you all document that very well in Refer already by tracking a little bit about the demographic information of those callers, their needs, their unmet needs, their underlying situations. And then we produce reports based on the data that you collect about those callers. So how many callers are asking for this information? How many callers are being referred? Are they following through with the referrals that we give them? And are they getting the help that they need based on the referrals? And then finally, are they satisfied, and are their situations improved because of this intervention that we call 211? Another key area where stakeholders are interested in is, what are the barriers to enrollment in these new health plans? Is it that there are transportation issues, or special populations aren't getting served appropriately? If there are any barriers that we can identify, we are a part of a group of stakeholders that includes funders that can help address those. So for example, there were two barriers that were identified very quickly with this healthcare stakeholder group. One was that consumers were having a really hard time identifying which physician or which hospital is associated with a particular health plan. So this healthcare stakeholder group got together and wrote a letter to each of the health insurance plans on the marketplace and actually had them change the way that they presented their information. Another example is that a barrier to enrollment is that we just didn't have enough navigators in certain areas of the state. And part of the lack of navigators is that the navigator training and certification costs money. So we have a group of funders who are investing resources in trying to overcome what the barriers are. So it's really important for us as a 211 network to help identify what are those issues that could be changed. And then lastly, what are the populations that are disproportionately affected? So for example, one of the areas that's been identified already is that individuals with HIV who are taking certain kinds of medications are having a hard time identifying which plan is best for them. So if that's something that we are aware of as a 211 network, we would want to filter that back to the healthcare stakeholders. So the data that you all generate as a part of 211 is influencing how this law is going to be implemented and how private and public dollars are really shaping the services for the future. And then we will also talk with you about something that you know very well, and that's the importance of good 211 service. You know, 211 is a trusted third-party resources. Callers call us because they can remain anonymous and confidential, and they tell us all kinds of things that they may not tell their doctor or their counselor or their tax advisor. And so we are a trusted resource, and we take that privilege very seriously. So we know that health insurance and healthcare services can be really confusing, and our role as a 211 system is really to help educate those callers about the options. And we know that it is confusing, and in that process we may actually have to educate ourselves as specialists about how insurance works, or what are premiums or deductibles or copays. What does it mean when the navigator tells me that this plan is an in-network plan, my doctor's in-network or out-of-network? So those are the kinds of things that we may have to help educate our callers about. Our work in 211 is really to educate, inform, and empower the callers so that they can make the best decisions for themselves, and to get them to the right resources who can help them if the assistance that we're providing in 211 is just not enough, if they need more. And lastly, our job at 211 is to record the information, the referrals, and the contact information for follow-up, because the outcome data for this project is going to be super critical to both the future of this project, but also shaping how healthcare implementation works in this state. We will just mention one of the areas that we all have to get a little bit better up to speed are some of the healthcare options that we have. In an earlier session of a webinar, we reviewed the types of health insurance in Indiana that we would be making referrals to, and the types of navigators or assister organizations, so I just want to review that very briefly. So as we do our pre-screening and referral, we might be providing a referral so that the individual can purchase health insurance. Right now, people can get a health insurance through their employer or through the insurance marketplace, or through an insurance agent. And the federal marketplace is a way that people can compare. And we know that some of you are getting calls from people who are employed, who have access to insurance, where they're saying, I want to compare my options. Maybe I can get a better deal on the marketplace. And in our next session, we will talk about that. As with a lot of our callers who are low income, we may be referring them to traditional Medicaid and the various types of Medicaid, which include Hoosier HealthWise or Care Select for people with disabilities. We might be referring to the Healthy Indiana plan, and that's for those individuals who make too much for traditional Medicaid or don't have children, primarily the working adults who can pay something but still make under 100% of poverty. And then lastly, there is a group of people, there is some debate about how many people it is. It may be 182,000, it may be closer to 300,000 Hoosiers are going to fall in what's called the coverage gap. And these are the people who make too much for Medicaid but too little to qualify for the marketplace. And those individuals who need services may still have to rely on the safety net providers like the federally qualified health centers and the like. And then we will, as a 211 network, make referrals to navigators and assister organizations. And again, we covered this in an earlier webinar, but just to remind you, there are a number of different types of organizations that are providing navigator and assister services, and it's a little confusing in Indiana because state law requires anyone who's providing that kind of function to be certified as a, quote, Indiana navigator, unquote. They have to be certified and trained by the state. So the types of programs that you're seeing doing navigation work include the CMS-funded programs, which include organizations like Aspen, which is serving statewide, Eskenazi, which is the old former Wishart Hospital in Indianapolis. We have a number of contractors through the IaUW Navigator Grant that we'll talk to you about, Plus One, which is a small business Focus, based out of Muncie, and then groups like Cognosante, who's doing a lot of work in the central Indiana area, SRA, or the federally qualified health centers, who each received some additional money to help with enrollment. A number of our hospitals and our health plans are actually having certified navigators where they are helping enroll in plans, but it's important for us as 211 system to recognize that there might be a conflict of interest for those hospitals and health plans because they are enrolling typically into a specific type of health plan. So a lot of the hospitals have an alliance or an arrangement or an agreement with a particular health plan, like an Anthem plan or a MedWise plan, and that presents a little bit of a conflict of interest. So our role in 211 is to disclose that if you go to this type of navigator, they're likely to promote a particular type of health plan. If you go to a CMS-funded navigator, they are going to promote the range of options. And that's just something we like to disclose, and Peggy Matson, our resource specialist for 211, is actually including that in the navigator service record, so you'll want to look for that. And then lastly, there might be some community and faith-based organizations that are also providing navigator services. So I will remind you, as we start to think through how do you do a pre-screening in the refer system, I just want to remind you that all callers are allowed to remain anonymous, but that Indiana 211 maintains minimum standards for data collection. So we always want to strive to get 85% of our records having a zip code. I know that many of your centers have a policy that you ask every caller for a zip code. There are some callers who will refuse, and there are some callers where you may not be able to obtain that, but remember that there's an 85% goal for zip code, 75% for ages and ethnicity, and 85% for gender. Also know that we want to collect as much contact information so that we can get those rich, detailed outcome surveys statewide, not just from a couple centers, but we need that from the entire state. So at this point, I'm going to walk you through a couple more questions and then turn it over to Brian to walk you through the refer. So just thinking about asking that question of, does everyone in your household have insurance? We wanted to give you some sample responses if you are asked some of the questions that we have heard you've already been asked. Things like, well, why are you asking? So we're giving you language to say something to the effect of, well, there are new healthcare options as a part of the healthcare law. The enrollment deadline is March 31st, so we wanted to make sure that our callers had full information about their options. And you can reframe that in whatever way makes sense and is comfortable for your language and your caller. If the caller expresses some concern about privacy, you might want to share that Indiana 211 maintains confidentiality and doesn't share information without the caller's permission. Or you might, if you get a sense that the caller is concerned about privacy as they go to those healthcare navigators or to the healthcare organizations, you might refer to the fact that they also are subject to a very strict confidentiality policy. You might get a question as you're asking that very first question, well, what do you mean by household? Who's in my household? And I've heard it answered, this kind of question answered in a couple different ways. One way is to say, well, usually the household is the individual or family members who file their taxes together. You know, for example, do you have any dependents that you claim on your taxes, or does someone else claim you? You know, what did your tax return show last year? Or what will your tax return show this year in terms of thinking about who is in that household? And this is where certain callers may have very complicated situations. We know that sometimes in divorce cases or adult children with disabilities, the tax filing situation may get very complicated, and that's where we want to be very tentative in our response to the caller if this is what may happen, or we need to refer you to a navigator to really explore that further, or this is what we understand, but be very tentative in your response. And now I'm going to turn it over to Brian to walk us through the actual refer sheet.
Okay, thank you, Lucinda. As you all know, for the most part, you've already been using refer and you know where to capture the zip code and the phone number and the first and last name. But I want to point out to you that just like SNAP, there are certain dollar values attached with filling in these fields. So make sure that you get a zip code, obviously, for your referral. Make sure you get a phone number because there is money attached to that for a phone number and for a first name and last name. And if you go to the next slide, you'll move on to, and this may be slightly different in each call center, but next tab is typically your data tab where you're asking the contact data information such as ethnicity. You're also going to open the new data form in the lower left corner. It is the Indiana 211 Healthcare Screening form, and if you'll go to the next slide, that pops up, and you'll start asking those questions. Make sure that you document the appropriate answers. For question 1, which is the question, does everyone in your family unit have health insurance? If the caller responds with no, you may say something such as, we are currently doing a pre-screening for eligibility for various options for health insurance. May I ask you a few questions to see if the uninsured person might be eligible for insurance. So those are some words that you can use to continue down the screening path, if you will. If the caller isn't interested in being screened, be sure that you mark the not interested in health insurance screening, the last item in question number 1. In question number 2, you may notice that it's broken down slightly odd compared to our SNAP form, and it's because we needed some better reporting, so we had to break question 2 down into 4 parts, 2A, 2B, 2C, and 2D. One is asking whether, 2A is asking one or more pregnant women, 18 or older, are uninsured. Question 2B is one or more children under 18 are uninsured. 2C is one or more non-pregnant adults under 65 are uninsured. And 2D is one or more adults 65 and older are uninsured. If they are over 65, you would want to make a referral to Medicare and make sure that you get contact information, again, so that we can do the outcome survey. In question 3, you're asking how many total people are in the family unit. Again, going back to how many people did you file taxes for. And then in question 4, we're talking about the income, and this is 100 to 400% of poverty level guidelines. So you'll select that, and it's an estimate from the caller's perspective for the last 12 months. And then, based on that income range, you'll select, which is not shown on the screen because we ran out of space, but based on the income range, the options are, if the caller is below income range, offer referrals to Medicaid, HIP, and or health clinics, depending on their current situation. Again, try to get contact information. The second option to that question is, if the caller is within range, offer referrals to Marketplace, call center, and or navigators, and explain subsidies. Excuse me. And then option C is, if the caller is above income range, offer referrals to the Marketplace, call center, and or navigator. And that we'll get to in just a second, is how you document those referrals. Or if the caller refused referrals, you would select option D. And we're back to the search tab, or data tab 1 in refer. To make those referrals, you're going to use, just like you do every day with food stamps or other items, you're going to search for Affordable Care Act, All of the Navigator resources that Peggy is working on are listed under Affordable Care Act Information and Counseling. And then in the match list notes, be sure to read the match list notes because Peggy is listing out hours, the type of enrollment services such as the Marketplace, Medicaid, and/or HIP, whether it's by appointment or if it's walk-in, such as Cognosante. Right above the green box is showing Tuesdays and Thursdays from 1 to 6 at the East 38th Street Public Library branch. That's how SNAP is set up as well, so this is very similar and should be very similar process for you to follow. But again, if you have questions, feel free to call Peggy or myself, and we'll be happy to get an answer to you. And I think at this point, I'll turn it back over to Lucinda.
Great, thank you. Great explanation. And if any of this is confusing, please let your supervisors know so that we can update our training information. So we did want to just make a couple references about language. We've given you a couple sample things to say, and we'll do that more in depth in our session 2 and session 3 for specialists only, but wanted to just remind you all that, and I don't think I need to, I think it's been in the news plenty, that the Affordable Care Act, also called the healthcare law, sometimes referred to as Obamacare, has been in the news and under a lot of scrutiny. It's a highly politically charged area. There are some people who absolutely don't agree with it. We find that most of the people that we're talking with don't actually understand it. So just wanted to give you a couple tips that we don't want to allow this to get into political conversations or partisan conversations. So while the callers may refer to the new healthcare law as Obamacare, we won't. We need to make sure that when we're repeating it back, we say, so I understand you're wanting information about the new healthcare law or about the healthcare law. We may also receive test calls. We know that a number of 211s across the country, because of the connection with the Navigator grant especially, have received test calls to see how are we screening, how are we making referrals, are we ensuring that we get consent from callers, do we get their permission before we do a pre-screening, do we get permission before we collect their name and their contact information. We want you to treat every call as a real call, even if you feel like it's a test call or that you're getting recorded. So you want to provide the best service possible, and if there was something quirky going on in your call, please alert your supervisor. We know that in the scale of the types of calls that you're doing now, with the system handling over 400,000 calls a year, it's hard to keep up with any call that sounded just a little odd or that may have raised some questions that we hadn't anticipated with regard to how we implement this healthcare project. So please just alert your supervisor if that's the case. And here are the contact informations for our great 211 Healthcare Project staff. So I hope that you all get a chance to meet Brian Metzler, the Healthcare Project Coordinator, and you see his contact information there. He is based up in South Bend, but also travels. And then Peggy Matson is the Indiana 211 Healthcare Resource Specialist, and she is based at Connect to Help and actually has a healthcare social worker background. So this is a very nice fit for her. And then you see me, Lucinda Nord. My contact information is there. I especially would like to be alerted if there are any questions from the media or big picture issues that we might need to address. So that concludes our first in our series of special webinars just for 211 specialists. Brian, do you have anything else to say?
I don't know, but just go SNAP and go healthcare.
All right. Great. Thank you so much, and we'll see you on our next recordings.